All right, hi everyone. I'm Dr. Sourabh Sharma. So let us see these ophthalmology questions which have been come in the last 1 week back in foreign medical graduate exam of 2025 July session. So the paper 2 had so many opthal questions, and as usual, there were I think 15 questions. I'm able to recall. I've got the recall of 14 questions plus minus one plus one. I'll tell you which one is the 15th, but 14 questions I've got with the options for you people. So we will see one by one, and I will tell you that see all these questions which we are doing, you can solve. I've taken one session only in this time in defects. That was only 7 to 8 hours session, and I will tell you only from that 7 to 8 hours defects, these 14 questions could have been solved. Let us see how, and let us see what can be the correct answers of the question. So this question have been asked multiple times, that a patient comes to you in emergency with a history of blunt trauma. Blunt trauma मतलब किसी ने मुक्का मार दिया, ठीक है? Blunt trauma means something as a ball has hit your eye or someone has boxed you, and following image was there. So radiology question plus ophthalmology question. This is the X-ray or CT scan showing the left side fracture. This is the floor fracture, and so many times this question has come to you. This is the orbital floor fracture. This sign is a fracture. And why orbital floor fracture? Because the maxilla bone is the weakest point of the orbit. That is a floor. So weakest point of orbit is in the floor, and the fracture is known as blowout fracture. That is seen in blunt trauma. So trauma question is very, very important, and this question has been asked multiple times. So if you see over here, why there is a zygomatic fracture is there in the floor, but the weakest point in the orbit is maxilla. That is a fracture known as blowout fracture. Now there is no hint of showing orbital cellulitis. Orbital cellulitis means there is infection, inflammation in the orbit. There will be pain, redness, and proptosis, protrusion of the eye wall. So there is nothing like that. And leaf-out fracture will include the entire nose also, not only the floor fracture. So particularly this question has been asked multiple times. This is from my DFX workbook. Hi Mini. So 2023, 2024, and now 2025 question is there. In my DFX workbook, I have given the questions. Even in my workbook of FMGE now, I'll give you all the questions of which have been asked previously. I've written this in DFX. This is the floor fracture because the weakest point of the orbit is the maxilla bone. That is blowout fracture seen in blunt trauma. Teardrop sign is there, as many told in the live YouTube session. And there is a forced duction test positive because the inferior rectus muscle is entrapped. So there is a restrictive squint. Patient will have difficulty in looking up. Here the question is directly to identify. So there was a straightforward question. I think 1 out of 1 question should have been solved correctly because it has a repeat question multiple times in a PYQ. Blowout fracture. There should be no mistake in a previous year question in any exam. Let us see the second question. Now second question is a PYQ direct repeat from the NEET exam 2023 or maybe 2024 or 2023. This which refractive error was asked in a patient having eye strain, and the focus of rays are different in different varieties. Even if you know focus of rays are at single point in myopia, single point in hypermetropia, and presbyopia cannot be the answer because it is a near point concept. So here if you see the vertical axis, there are two axes we have to see in the ophthalmology. Vertical axis of cornea, horizontal axis of cornea. Vertical is focus at point number B, horizontal is focus at point number F. Now if they are not focused at a single point, the answer is astigmatism. And this concept was given by a scientist which is known as Stooms. Now some student said that Stooms was written in the text, some said no. Doesn't matter. Here both the focus point, here astigmatism means that both the focus point are not focused at a single point. Multiple points are focused. That is astigmatism. Because you should know that myopia, hypermetropia, all the rays are focused at a single point. Before the retina myopia, behind the retina hypermetropia, and this presbyopia is a near point concept. Near point goes away from the eyes. That is presbyopia at a particular after age related concept. So this is astigmatism, Stooms conoid. They can go one step further, which is with the rule, against the rule. Till now, they have not asked in FMG. This is a repeat question, same image, same question was asked in NEET exam. So NEET FMG, FMG NEET questions are overlapping. So those who are writing exam for NEET exam 2-3 days after, they should see the FMG questions as well. Good, Mini. Mini is the one which is answering the question on YouTube live. That's why I'm naming her. Good answer, Mini. Alright. Now this is also repeat question, direct repeat question from NEET exam. But it's a simple question because, see, there are brown, it is given that in the superior limbus, identify the lesion in the superior limbus. Limbus is a corneoscleral junction and there is a brown black depressions in the upper limbus. Now that is Herbert pits that is seen in trachoma. Actually it is pathognomonic for trachoma. Now some people get confused by Horner-Trunter dots. Horner-Trunter dots are white dots in vernal keratoconjunctivitis. That is due to eosinophils, mast cells, epithelium debris. These are in trachoma, there is follicles and this healed follicles which gives the pits known as Herbert pits. Pannus is vascularization plus infiltration comes into the cornea in trachoma, but that is vessels and inflammation coming, not the pits. And Bitot spot is seen in vitamin A deficiency. That is a very important repeat question. Multiple times it has been asked. Hi Roshan. Many again good answer. Now Herbert pits is the direct question. You should know trachoma. Trachoma caused by chlamydia trachomitis, again from DFX, FISTO, FISTO classification, follicles, inflammation, scarring, trichiasis, opacity. But Herbert pits is not included in FISTO classification. That's why WHO gave a safe strategy to compensate, as I told in the class. So safe strategy was repeat question in January 2023. Now this is a repeat question now in July 2025. That is same picture, Herbert pits in trachoma. Same picture was asked in the exam. Same picture was asked in NEET exam. Same was asked in FMG exam. Hi Roshan. Hi. Chajal Kajal. Chajal Kajal. Kajal Chajal. अरे नाम चजल है या काजल है? काजल नाम होना चाहिए. Now this one question on visual field is definitely going to come in an exam. In a patient of pituitary adenoma compressing the optic chiasma. So you should know that this is cavernous sinus which is behind the apex of the orbit. Above that is pituitary gland. Above that there is optic chiasma. And the optic chiasma, the nasal fibers are of the optic nerve are crossing. If the nasal fibers are crossing, the nasal is representing the temporal part of the visual field. So patient has bitemporal hemianopia. That is the answer. Homonymous hemianopia is seen like this. And this is the lesion when there is some lesion behind the chiasma on the right side. This will be left homonymous, for example. Quadrantanopia will be seen either in temporal lobe lesion or in parietal lobe lesion. In temporal lobe superior quadrantanopia, in parietal lobe inferior quadrantanopia. Now central scotoma, always visual field has to be represented as patient's view. So this is right visual field, this is left visual field. So this is right visual field because this is blind spot. This is central scotoma, seen in optic neuritis, optic neuropathies. Now one question on visual field is definitely going to be asked. Now in the optic chiasma, point number 2, which is I told you in the DFX workbook. If chiasma is involved, bitemporal hemianopia should be the answer. That is the only heteronymous visual field defect. One question of visual field is mandatory in any exam. So bitemporal hemianopia, and why example is pituitary tumor? I told you because above the cavernous sinus there is pituitary gland. Above that is optic chiasma passing. So optic chiasma defect will lead to bitemporal hemianopia. Answer will be like this. This is right, this is left. So that is the only heteronymous. Heteronymous means opposite side visual field defect. So I think I've told you 4 questions. 4 out of 4 should be there, or maybe 3 out of 4, doesn't matter, but at least 3 questions out of 4 should be correct from now. Alright. Now, some people think it's a difficult clinical question, but no. See the keywords. A high myopia. High myopia means more than 6 diopter myopia. Means we're wearing -7, -8, -9 degree of glasses. High myopia with sudden onset of floaters. Now floaters words suggest that something is there in the vitreous cavity. Flashes means a neurological symptom known as photopsia. Patient realizes that something is going in front. Though there are only 3 differentials of flashes which I always tell in any class, whether INI, CT, NEET or FMG. That flashes is seen whenever there is a pull on the retina. like in rhegmatogenous retinal detachment, like in flashes can be seen in this posterior vitreous detachment, rhegmatogenous retinal detachment, and ocular migraine. So here PVD and refractive retinal detachment both have flashes. Both can have floaters also, because in rhegmatogenous retinal detachment, the retina pigment cells can come into the vitreous cavity, leading to Schaffer sign. In posterior vitreous detachment, there is a vitreous debris. So both can lead to floaters flashes, but see, this is the keyword. A curtain-like visual field defect. Visual field defect is not a feature of posterior vitreous detachment, because you see from retina, you don't see from vitreous. So answer has to be retina detachment. Many students may have answered vitreous hemorrhage. Vitreous hemorrhage will have floaters, will not have flashes and curtain shadow like a visual field defect. And central series retinopathy will not have floaters, will not have flashes. It is a young male, metamorphosia, distorted vision, type A personality. Exudative retinal detachment example is only central retinal detachment, that is exudative type, is CSR. So answer has to be rhegmatogenous retinal detachment. Now this has been dealt with. See, same question, same wording in the defect workbook. I have given a high myopia with floaters, flashes, and a student has given this workbook. She has given me some snapshots of that. It's a positive scotoma, I told you, floaters, flashes, curtain, shadow falling, that is rhegmatogenous detachment, and floaters due to Schaffer sign, retina cells in the vitreous cavity, that is leading to floaters. Convex configuration, rhegmatogenous detachment, that is the answer of this question. Should be 5 out of 5 if you have attended the DFX. Ketan Bhuva saying mechanism पूछा था. Proliferative diabetic retinopathy was one of the option, Roshan, in this. Proliferative diabetic retinopathy will have tractional retinal detachment due to new vessels which is pulling the retina upwards. Was there a separate question or same question? Let me know. Then a similar question, maybe Ketan, you are asking this one. A similar question was there. Now I've got two questions on this. Let me know which one is correct. I will give you option number 1 and this is option number 2. Let me tell you option number 1 first. So option number 1 says a 10-year-old patient presented with decreased vision. On slit line examination, supratemporal lens dislocation was there. Posterior cephaloma seen in indirect ophthalmoscopy. Now posterior cephaloma is a hallmark of high myopia. But high myopia does not have lens dislocation. So here if lens dislocation is given with posterior cephaloma means Marfan's has, Marfan's is a specific answer because Marfan's has lens dislocation and Marfan's can have myopia as well. So here in this question Marfan's can be the answer. So let me know if this option 1 was the question or option 2 was the question in which a 10-year-old patient presented with decreased vision and only posterior cephaloma was seen on indirect ophthalmoscopy. What is the underlying condition? Here lens dislocation was not given. So here the answer is directly high myopia. So let me know option 1 or option 2. Roshan, Shreya, Mini, let me know, Ketan, that one option, this was there or 2 was there? 1 or 2? If 1 is there, the answer is Marfan's because lens dislocation is there. Now if 2 is there, the answer is high myopia because only posterior cephaloma is there, and posterior cephaloma is a hallmark. Of high myopia. Again from DFX I have told you this. High myopia features I have told you. Different type of cephaloma I have told you. Hallmark is a high myopia, posterior cephaloma. But if Marfan's is there, then answer is, if lens dislocation is there, then answer is Marfan's. Please let me know in the chat box. Till then, I will take up the previous year. Ketan, that question will come later on, no? The light reflex one. Well, that will come later on. This was a different question. Let me know 1 or 2 option. Okay. Now, patient presents with sudden onset severe eye pain. Now, acute red eye question is very, very important. Severe eye pain, headache, blurred vision, colored halos. Mid-dilated pupil is a keyword. Steamy cornea means maybe there is a hazy cornea. Now, with high intraocular pressure. Now, everything is same in acute anterior and acute primary angle closure, but the clinching point is mid-dilated pupil. If they have given the same question with a small irregular pupil, then the answer is anterior uveitis. But here they have given the question of mid-dilated pupil. In the NEET exam, they told a similar question, that a patient came after seeing movie with eye, acute redness, headache, blurred vision, colored halos, mid-dilated pupil, image was there. Then answer is acute primary angle closure. Here they have not given that patient is coming after movie. Movie नहीं दिखाई उन्होंने, नहीं दिखा, मन नहीं था movie दिखाने का, तो इसमें सिर्फ ऐसे ही बुला लिया patient को. But mid-dilated pupil, answer is acute primary angle closure is the answer. Orbital cellulitis cannot be the answer because proptosis, orbit signs are not there. Proptosis, eyelid edema, painful red eye with proptosis. Acute endophthalmitis is not the answer because in endophthalmitis the vitreous has to be involved over here. Vitreous involvement is not given over here. So answer has to be acute primary angle closure. Let me know that previous now 1 or 2 option, that question. And this is, I told you in the workbook, even in July 2024 this question came, that on pupil dilatation, psychologic darkness, patient intern ने गलती कर दी थी, darkness में बताया, acute painful decreased vision, there is a walked triad, WEGT walked triad, vertically dilated pupil is there, acute angle closure is the answer, mannitol pilocarpine is given, iridotomy is the treatment of choice. तो केतन भूवा acute primary angle closure option में होगा या acute congestive glaucoma, both are same answer. If that isn't the option, that is the same, that the wording is different. Previously it was known as acute congestive glaucoma, now it is known as acute primary angle closure. Acute closed angle glaucoma भी हो सकता है, that is the answer. शाहरुख जी कुछ पूछ रहे हैं, एक क्वेश्चन था यूसी करके साथ कौन सा एसोसिएशन होता है एंड यूवियाइटिस वाज द ऑप्शन. वो क्वेश्चन पूरा लिखा है, मेरे को तो किसी ने बताया नहीं, मे बी द 15th क्वेश्चन व्हिच आई एम वेटिंग फॉर. So here the answer is acute angle closure, acute primary angle closure, acute congestive glaucoma or acute closed angle glaucoma, same thing. Now 2 questions are asked in in corneal ulcers. 2 questions. One was this, that a patient presented with painful blurred vision, photophobia, that is intolerance to normal light, with contact lens. Now one student has told that only this information was there. Now only this information without this ring-like infiltrates. If ring-like infiltrates is given, the answer is acanthamoeba. But if only contact lens, painful blurred vision, photophobia is there, then the answer is pseudomonas, because pseudomonas is the most common organism with contact lens. But अगर नलके से पानी से धो के बहना, wash with dirty water, which was not given, but a ring-like infiltrates is the classical of acanthamoeba. If ring-like infiltrates is not there, then answer is pseudomonas. Now similar question was there, that but a different question. Patient presents redness in one eye with photophobia, a branched ulcer desquamation is there and reduced sensation. Now reduced sensation is a keyword, branch ulcer is the keyword. Reduced sensation can be seen in herpes simplex, herpes zoster, but branch with desquamation, with branched with dilated ends known as knobs, that is a classical of herpes simplex. Herpes zoster has a tapering ends. So that is not the answer. Reduced sensation in viral keratitis, because virus stays in trigeminal ganglion, that is a sensation of the cornea. Now fungal keratitis, there can be a keyword like dry, rough texture, satellite lesions. In acanthamoeba, ring-like ulcer is there. Shahrukh, that might be a medicine rheumatology question, that ulcerative colitis is eye association uveitis, that is correct. But nobody has told me, because maybe medicine people have taken, they have snatched the question. खींच लिया उन्होंने questions आए, हमारे पास आया नहीं. Okay, so there's 3 type of ulcers in the defects. This keyword satellite lesion, dry rough texture in fungal keratitis, acanthamoeba, नलकी के पानी से धो के पहना, signs are less, symptoms are more, radial neuritis is there, stain, desquamation, dendritic ulcer, that was the question, that is herpes simplex keratitis. So 2 questions on ulcer was there. If Shahrukh is saying dendritic was option in this question, then dendritic is the answer. Dendritis is classical of herpes simplex. Herpes simplex is the organism, dendritic is the ulcer which involves the epithelium. Simplex is the organism, dendritic ulcer is the name of the ulcer, because dendrite means the knobs are bulging. Pseudodendrites are there in herpes zoster because the ends are tapering, which I have told you just now. Now eyelid question was there, a patient presented with painful eyelid swelling with the pus pointing at the base of the eyelash. Now what is the most likely gland involved? So if you see over there, see, I have told you in the defects workbook that if there is an eyelid, this is a hair follicle. At the root of the hair follicle, there is a Zeiss gland. And infection of eyes and the hair follicle is external because it is outside eyeball, that is external hordeolum. Internal hordeolum is related to meibomian gland, that is in the tarsus, that is in the posterior eyelids. So here the root of the hair follicle is given, and the hair follicle at the root there is Zeiss gland. So Zeiss gland infection was there asked in the question, and that is nothing but external hordeolum, also known as stye. Meibomian gland is internal hordeolum. Chalazion, chronic condition also related to meibomian gland. Internal hordeolum is infection of meibomian gland. And lacrimal gland is supratemporal in the orbit, that is not related to eyelashes. So eyelashes is involved, at the base of the eyelash has to be Zeiss gland. Good, Roshan, that is the answer. Zeiss gland, external hordeolum. Good, Shreya. Now this was a question where corneal reflex was given. This is the primary gaze picture, means patient is asked to look straight. This is the right eye of the patient, this is the left eye of the patient. See, the corneal reflex is in the center in the left eye, but it is not center, it is in the eye is going outside. So eye outside is known as exosquint. In squint, eye inside is known as eso, outside exo, hyper up, hypo down. So this is exotropia. So ESO is out of question. Now the thing is, how much degree of prism diopter? When the reflex is at the limbus, corneoscleral junction, that is 45 degrees of squint. But 45 degrees, 1 degree equal to 2 prism diopters. So 45 degree equal to, we are good in maths, that's what took biology, 90 prism diopters. Exotropia is the answer. Now this I have told you. Similar picture, but ESO I gave you in the DFX. 45 degrees of squint at 1 degree equal to 2 prism diopters. Here they are given exo 45 degrees, but 1 degree equal to 2 prism diopters. So they are given in prism diopters. So that is right, exotropia, 90 prism diopter or 45 degrees. हाँ, शाहरुख यही वाला क्वेश्चन था. एक्सो ही था, मुझे बहुत सारे लोगों ने कंफर्म भी कर दिया, यही क्वेश्चन था. तो केतन भुवा कह रहे हैं सिर्फ एक्सोट्रोपिया था, 19 नहीं था, प्रिज्म डायप्टर भी नहीं था, तो 90 डिग्री था. तो 90 डिग्री तो हो नहीं सकता ना भाई. एक्सो था तो 45 डिग्री होगा या 90 प्रिज्म डायप्टर होगा. अगर वो लिम्बस पे था तो सबने बोला लिम्बस पे था. इसमें हॉरिजॉन्टल 90 ऐसे ऑप्शन थे. कैसे ऑप्शन थे बताना जरा. पहले बता रिफ्लेक्स लिम्बस पे था या नहीं था. सबने बोला 90% लोगों ने बोला रिफ्लेक्स लिम्बस पे था. तो 45 डिग्रीज या 90 प्रिज्म डायप्टर होगा. एक्सो तो होगा, ईजो तो हो नहीं सकता. तो बताओ क्या आंसर होगा. दो क्वेश्चन थे स्क्विंट पे. दिस वाज एंड दिस वन वाज आल्सो इन द स्क्विंट. तो स्क्विंट में अगर नर्व पाल्सी है, अगर देखो टोसिस है and divided eyes means squint hai, is most likely to have where. Now ptosis has to be there only in third. 7th nerve palsy does not lead to squint, and 6th nerve palsy means lateral rectus palsy, LR6, esotropia. 4th nerve palsy is eso palsy, hypertropia. Down and out eye, divided eye with ptosis. Ptosis why? Because levator palpebrae superioris muscle is also supplied by third nerve. So if ptosis is there in a squint, it has to be third nerve palsy. Again the image from the workbook. A child with having ptosis with down and out eye, pupil dilated, that is nothing but third nerve palsy question. अच्छा, केतन कह रहे हैं सिर्फ एक्सो पूछा था और इसमें डिग्री पूछा ही नहीं, तो बहुत ही सिंपल आंसर हो गया फिर तो. अगर सिर्फ एक्सो पूछा था तो बाकी ऑप्शन क्या था केतन. बाकी ऑप्शन था क्या एक्सो ईजो, बाकी भी तो होंगे. थर्ड फोर्थ एक्सो ईजो हाइपर हाइपो था क्या, वो बताओ मुझे. This is a question has been asked previously also. A patient on eye examination showing pupil reaction to near reflex. When near reflex pupil is constricting, but on light reflex it is absent. This is light near dissociation. Where is the lesion? Light near dissociation. That is Argall-Robertson pupil. Lesion is in pretectal nucleus. Accommodation reflex means near reflex present, light reflex absent. FMGE question 2023 July. In defects also have taken that. In AD's pupil will be, Holmes AD will be ciliary ganglion lesion, one side dilated pupil. Amaurotic pupil will be there in optic nerve. Wernicke pupil optic tract. Marcus Gunn pupil in partial lesions of optic nerve. But this is Argall-Robertson pupil. हाँ, तो दीपक देखो कह रहे डिग्री वाज आस्क्ड और केतन कह रहे डिग्री. अलग अलग एग्जाम देकर आए हो क्या तुम, केतन एंड दीपक आपस में बताओ मुझे डिग्री थी नहीं थी तो मैं क्या करूं, मैंने तो नहीं दिया एग्जाम इस बारी. So here the answer is pretectal nucleus. Third, oculomotor, that is Edinger-Westphal nucleus, will lead to dilated pupil. That's what I told you in the previous question. Optic nerve will lead to amaurotic, means no reaction at all. This is Argall-Robertson pupil. A sexually transmitted disease, neurosyphilis is the most common cause. Light reflex absent, near reflex present, that is Argall-Robertson pupil. Roshan, very good. Neurosyphilis is the answer. Now the next question was, a patient was having a 45-year-old patient. पेन लिख दिया मैंने. पेशेंट आई एग्जामिनेशन डीप एंटर चेंबर एंड जेट ब्लैक पीपल एंड +11 diopter glasses was. Now +11 diopter glasses was prescribed. Now plus is given in hypermetropia, so myopia is not the answer. Such high diopter myopia, high diopter hypermetropia is there. Now pseudophakia means you are putting an intraocular lens inside the eye. It can have deep enter chamber, yes. Now what is happening over here? Why you are giving such a high power plus lens? Because if there is an absence of the lens, the light will not be able to converge from the lens because there is no lens. The light will go behind because only cornea has the converging power. So this is aphakia, which is a type of hypermetropia, very high positional hypermetropia. So it is hypermetropia, but aphakia is the specific answer because jet black pupil, deep iris has no support, so iris will go behind deep entry chamber. So plus diopter means hypermetropia. Aphakia, hypermetropia, both are there, but aphakia is the correct answer because aphakia has jet black pupil, deep entry chamber, and very high number of glasses are given because only cornea has a converging power, lens is not there, so eye will go very much behind. You have to converge the rays to the retina by giving very high spectacles, that is +11 +12 diopter glasses. That is the answer of here. 12 डायप्टर था. चलो कोई फर्क पड़ेगा क्या शाहरुख खान जी कि 12 डायप्टर था, या शाहरुख आपके ऊपर एक नाम है SRK फॉर्मूला होता है ऑप्थोमोलॉजी में. हाँ FAK था इसका आंसर. वेरी गुड. अरे तो 15th क्वेश्चन. अब 15th क्वेश्चन आई एम नॉट श्योर दैट 15th क्वेश्चन वाज many students have told me that one question on shield ulcer was there or not. So I am not sure that shield ulcer was given, and that is nothing but vernal keratoconjunctivitis. This question was got or there or not. During the recall, many students on that day on the exam they said no, it was not there. But some student after that said हाँ सर हमारे में तो था. अलग अलग एग्जाम देकर आते हो आप, तो शील्ड अल्सर था या नहीं था मुझे पता नहीं. But 14 questions we have discussed, and at least 13 question at least you should have got it right out of 14. अब शील्ड अल्सर क्वेश्चन हुआ वो तो रिपीट क्वेश्चन ही है, पहले भी आया हुआ है, वर्कबुक में मैंने बताया था. वर्नल केराटोकंजंक्टिविटिस शील्ड अल्सर. अब चेजल काजल जी कह रही है नहीं था. नहीं होगा मेरे ख्याल से भी. मेरे को 80% लोगों का नहीं था, 20% लोगों ने कहा था. पता नहीं वो क्या था, नहीं था. बट आई गॉट ओनली 14 क्वेश्चंस नाउ. 15th क्वेश्चन. अब देखो यहीं पे शायद हुसैन जी आगे कह रहे हैं कि शील्ड अल्सर था, एंड शाहरुख वाज सेइंग कि नहीं था. दीपक जहांगीर कह रहे नहीं था. यही तो फिर अब रिकॉल एरर हो जाता है यहाँ पे. मीर शाहिद हुसैन कह रहे हैं मुझे अच्छी तरह से याद है कि था. आई वाले इमेज क्वेश्चन था कॉर्नियल रिफ्लेक्स में, वो तो हो गया ना क्वेश्चन केतन, वो एक्सो वाला. और देखो शाहिद हुसैन कह रहे 100% था, तो 100% था तो फिर आंसर तो वर्नल केराटोकंजंक्टिविटिस होगा. ये तो और ये 15 क्वेश्चन तो आते ही आते हैं ऑप्शन में. 14 मिल गए, 15th नहीं मिला. तो मे बी शाहरुख जी, शाहिद हुसैन जी एकदम कॉन्फिडेंट कह रहे हैं तो मान लेते हैं उनकी बात. तो शील्ड अल्सर पे शाहिद आपका फिर एक जॉब है, मेरी एक हेल्प करो. तो आप एक क्वेश्चन फ्रेम करके मुझे मेरे ये या तो टेलीग्राम पे या इंस्टा पे या यहाँ पे वहाँ पे कहीं पे भी मुझे प्लीज़ ये क्वेश्चन फ्रेम करके दो ऑप्शन के साथ कि क्वेश्चन क्या था, क्योंकि आप 100% श्योर हो, आपने दिया था, तो आप ये क्वेश्चन मुझे बताएंगे. ठीक है. अदरवाइज यू हैव डिस्कस द 14 क्वेश्चंस. दिस इज माय नेफ्रोलॉजी बुक. नाउ आई होप यू हैव डन वेल. अच्छा ही होगा, रिजल्ट आएगा सबका अच्छा होगा, आई होप सो. अभी रिलैक्स करो, अपने इवैल्यूएट कर लो क्वेश्चंस कितने सही करें, एंड बेस्ट विशेस फ्रॉम माय साइड. ऑलराइट. सब लोग लड़ रहे हैं कि शील्ड से था, बीकेसी था या नहीं था. अच्छा, केतन कह रहे हैं कि 2 आई की इमेज दी हुई थी, तो वो एक्सो वाला तो केतन हमने सॉल्व करा है ना, उसके अलावा भी कोई क्वेश्चन था. शाहरुख एस्टिग्मेटिज्म वाला क्वेश्चन तो कर लिया ना हमने, स्टूम्स कॉनॉइड वाला। केतन अगर आपको लग रहा है कि वो एक्सो के अलावा भी और कोई क्वेश्चन था तो प्लीज मुझे भी टेलीग्राम जी पे, टेलीग्राम जी बुरा मान जाएंगे, उन पे कर दीजिए या इंस्टाग्राम पे कर दीजिए, कहीं पे कर दीजिए। दोनों आई की हैंड से ड्रॉ की क्वेश्चन की इमेज थी। तो केतन वो एक्सो वाला अगर तुम नहीं बात कर रहे तो मुझे आप प्लीज वो क्वेश्चन दीजिए, क्योंकि 15th क्वेश्चन तो अभी भी शील्ड अल्सर था या नहीं था, या केतन आपका वाला क्वेश्चन था या नहीं था, वो अभी भी डाउट है। 14 क्वेश्चन में तो कोई डाउट नहीं। ठीक है, चलो थैंक यू वेरी मच, जस्ट रिलैक्स, वेट फॉर द रिजल्ट। अच्छा होगा, अच्छे होने के बाद आप मैसेज करना मुझे, आई विल बी हैप्पी टू नो योर रिजल्ट। ऑलराइट, थैंक यू।